I want you to hear Obama. Excuse me. Slip of the tongue. I want you to hear McConnell again at the University of Louisville on Obamacare. Man's had more positions on Obamacare than Sybil had personalities. Cut 10, go.
I will say this for sure. There are pieces of it that are deeply, deeply unpopular with the American people. The medical device tax.
Stop. The medical device tax, that's not deeply unpopular with the American people. You know who's lobbying against this? They got a horde of lobbyists on Capitol Hill. This is the one tiny thing in 2,300 pages, 20,000 pieces and regulations, the medical device tax. Not the $6,000 deductible. The medical device tax? Go ahead.
Which has exported an enormous number of jobs. The loss of the 40-hour work week, big mistake. That ought to be restored. The individual mandate, people hate it. So I think we will be addressing that issue in a variety of different ways.
And yet, this is the ad he ran 3 weeks ago. Cut 11, go.
As a doctor, I see how Obamacare hurts patients' access to care. As a mom, I know it hurts families. My son has diabetes, and our insurance was canceled under Obamacare. Like many, we now pay more for less coverage. Mitch McConnell is working for common-sense health care reforms. That starts with repealing Obamacare, and Mitch is leading the fight.
Stop! Did you hear that? Did you hear that? 3 weeks ago? People in Kentucky, it starts with repealing Obamacare, not medical device tax, the individual mandate, repealing it. Oh, Mark, stop. Stop what? Should we surrender our intelligence and our ability to reason? Why? One more before we take a break. Kevin McCarthy. This guy's the kind of the bumbling moron of the leadership. He's the majority leader in the House. And he's on Fox News last night with Megyn Kelly. Asked about Obamacare. Cut 12. Cut 12. Go.
Now you're going to press it again as another agenda issue.
Well, I think we would repeal Obamacare and replace it. Replace it with a health care system that empowers the individual to have the relationship with the doctor, not with big government.
So you would like to see that brought up for another vote in both the House and the Senate?
I would like to see a new health care system that actually lowers premiums instead of raising it, that actually empowers an individual to make a decision. I know, with respect, sir, though, but those sound like talking points. I'm trying to get an answer on whether you're going to press for another vote to repeal Obamacare in the House and push for one to I would press for one when we have ability to replace it at the same time. But the first
there you go. Stop. We're going to press for it when we have the ability to replace it at the same time. In other words, if we have a Republican president. There you go. I told you when this law was passed, this Obamacare law, when Obama signed it and the Supreme Court certified it, I told you it was here for good, that the Republicans would not repeal it. And this is what we mean by the ratchet effect. The left gets its way, the Republicans nibble on the edges, and our lives are changed forever, our lifestyles are changed forever, because they're in a 100-year war against liberty and capitalism and constitutionalism, and our guys buckle. They fold like cheap tents. Immediately. I'll be right back.
Mark Levin.